17 minutes now before the hour. State of Maryland deciding today whether to dump its troubled Obamacare exchange and replace that with a system from another state. The failed site in Maryland cost an estimated $125 million so far to build. Republican Andy Harris is from Maryland. He's also a doctor, back with us here today. And, sir, how are you? Good morning there.
Bill, good to be with you.
In Baltimore. What did Maryland taxpayers get for their money so far?
Well, they've got nothing. Apparently, again, the state wants a do-over. They spent hundreds of millions of dollars. I think it's more than $125 million because they haven't paid some of the contractors because they're in court. Again, everybody's pointing fingers at everyone else. Obviously, the oversight left a lot to be desired, but they want to, again, they want a mulligan. They want to bring in the Connecticut system and see if that'll work any better.
I say, what, Connecticut did it better? Is that what we're to believe?
The Connecticut system worked better, but the Connecticut system also was less complicated. Maryland tried to do their Medicaid re-enrollments through the system, and that overloaded the system. If they try to do the same thing on the Connecticut system, that might not work either.
Yeah, I'm here 6 months down the road. I mean, how did your state screw this up so badly?
Well, I don't know, and that's why we have an inspector general from the federal department looking into it, because they had 3 years to get it done right. They can't, and again, they have about 7 months until they have to go online again, which is, I think, why they're making this decision this early. Although, again, in the sense of things, it's not a whole lot of time to get a new exchange set up. There are a lot of people in Maryland, in the legislature, at least on the Republican side, who think they should have gone with the federal system, and again, not take another chance.
Just go with the federal system would have saved Maryland a lot of money, I guess, in retrospect.
Absolutely. Yeah. Tens of millions of dollars.
How much?
And again, you know, yeah.
How much more money do you think you're going to have to spend before you get this right?
Well, the low estimate now of adding Connecticut's system is at least $30 million, but I suspect it's closer to $60 or $80 million. And again, the question is, why don't we just go to the federal exchange, which, look, it doesn't work perfectly, but it works a whole lot better than the Maryland exchange.
You're saying you're going to spend $200 million in the end to get a website up and running?
The estimate was $261 million all said and done.
That's crazy.
And that's just stunning. That's stunning. It's $250 million, and again,
listen,
we're not sure it's going to work.
People are building websites in their garage all over America. How can this happen?
Look, we're going to get to the bottom of it. The Inspector General is going to have to take a good look at how Maryland could have spent that much money and gotten a product which literally they're just walking away from.
Also the sign-ups. Now, I believe, according to the numbers, these from Wall Street Journal, 50,000 thereabouts as of March 22 of this year. And the target, or at least they had hoped to have about 150,000 people in your state sign up. If those numbers are true, and I'm asking you if they are or not based on your understanding, you're 1/3 of the way there.
That's right. They won't get even to the lowered target. They lowered the target just like the federal government did. They lowered the state target to 70,000. They're not going to get to 70,000. We still don't know how many of those people have actually paid a premium. We don't know how many of those people were part of the 70,000 that had their insurance policies canceled last year. So, again, we just don't know anything. The Maryland system couldn't even give us the answers to those questions.
And you don't know how many people did not have insurance before that signed up on the exchange already, correct?
We have no idea. We have no idea how many truly uninsured people got insurance through the exchange. We already had a plan that paid for pre-existing conditions, people with pre-existing conditions in the state. So I suspect that the number of newly uninsured people who get insurance on the exchange is actually going to turn out to be quite low. And we spent a whole lot of money to get there.
Yeah, I know it. I bet that's well documented. On the national level, do you have an idea yet how many people who did not have insurance before now have insurance as of March 31st, yesterday?
No, we don't. What's stunning is, you know, the federal government has spent over $600 million to do the exchange, and their exchange can't answer the simple question, by the way, did you have insurance before? Which is the key question. If the whole goal of this was to get people insurance who didn't have insurance before, you would think that that would be one of the pieces of data the federal government could have answered, having spent $600 million, more than that, on developing their exchange.
Well, you know, when the debate started four years ago, we were told 30 million Americans were uninsured. And somehow that number popped from 30 million to 40 million plus. And Did you get 1 million signed up? Did you get 2 million signed up? I mean, how many people did you cut into in that number in the previous 6-month sign-up period on a national level? We don't know. And for what?
We don't know, and that's unbelievable. The fact that we can't answer that question, and the Secretary Sebelius comes before committees in Congress and just admits not only they can't answer it, they probably will never be able to answer it.
Why? Why never?
They just don't. They didn't collect that information, and you'd have to go to each insurance company and then match who dropped a policy with who picked up a policy. It's just not part of the law. The law didn't seek to answer that question when they set up the exchanges.
I imagine the information is somewhere. You just got to track it down, put it together. Andy Harris, thank you for your time. Republican from Maryland, thank you for your time out of Baltimore, sir.